Moving forward, I would now like to commence with our today's program. I feel honored as I introduce our first renowned speaker, Vaidya Anura Bale ma'am, Principal of Gomantak Ayurveda Mahavidyalaya and Research. Ma'am is a member of Advisory Council, Indian System of Medicine since January 2021. Guide for PhD at Tilak Maharashtra Vidyapith Pune. She has received many awards like Best Teacher Award by AISRI, Dhanvantari Award by Sandu Pharmaceuticals, and Ayush 2015. She has a teaching experience of 25 years and has delivered guest lectures on various public platforms and organized over 24 seminars. I request ma'am to please come on the dais and begin with the first session of Augustcon 2022.
My colleagues, speakers, and my dear students I can see here. I'm happy that Vaidya Ashutosh Nanal sir, Satyavrat Nanal and Madam Isha Nanal is organizing this Augustcon International Conference in the memory of Vaidya Vilas Nanal sir. When we were studying in Tarachand, Tilak Ayurveda, way back in 84-85, we were going to Vaidya Bapu Nanal sir. And Vaidya Vilas Nanal sir was my own guru who taught us in Tarachand hospitals. His expertise in differential diagnosis opened up students' mind towards understanding the intricacies involved in diagnosis. So I'm happy I'm here today because of all my gurus who has taught me in Tarachand Hospital. So I'm happy that Nanal Research Foundation is organizing this Augustcon International Conference. When we were just discussing in the morning with Ashutosh Nanal sir, what he said is, Madam, this was my topic for the thesis. And this I wanted to start with diabetic neuropathy. And my guide was Madam Asmita Vele when I was studying for MD. So I wanted to start with this topic and I've given this topic to you. So to start with, as we all know that the blood sugar levels being the parameters in diagnosing diabetes, very often it is seen that though sugar levels are well maintained throughout within the specified parameters, multiple symptoms are being observed. India is being said as the diabetic capital of the world. We are continuously finding newer symptoms and diseases regularly. One of the complications of this diabetes mellitus is diabetic neuropathy, accepted world over. And presently, the modern science is yet to find treatment protocol for the same. Though they have put forth some neurological tonics and vitamins which have shown certain amount of result momentarily, there is no claim that it has 100% cure. But concept of Srotasa, Samprapti, can clearly define the pathway of the said disease based on the disease and individual prakruti. Medications put forth have certainly shown curative results by our science. So the Ayurvedic medicines has proved real blessings for the patient living with diabetes, not just through the care, but also through the development of natural safeguards. And for additional harm, it is important to know about diabetes, its forms, before understanding how the Ayurvedic medicines of the diabetes functions. Here are some different patterns of neuropathy presented in an individual with diabetes, like diabetic cardiomyopathy, diabetic foot, diabetic neuropathy. You can see in the neuropathy, even reduced blood flow is seen here. Then most commonly found in the old age is diabetic retinopathy and stroke. Next. Next. Diabetic neuropathy. Among 30% of the affected population show symptoms of neuropathy. Drugs for maintaining sugar levels are very much in use and show excellent results, but within negative side effects. That is why it is mandatory for an Ayurvedic physician to look for treatment which will show positive and curative effects. Next. So these are the following causes we can see why the diabetic neuropathy occurs. It can be mainly due to diabetes, infection, side effects of medication, vitamin B deficiency, mechanical factors, stress, autoimmunity, and hereditary. Next. We can see what are the main symptoms. We have seen the causes. So what are the main symptoms? The 5 main symptoms are unusual sensation, paresthesia such as tingling, burning, and pricking, numbness and pain in hands, legs, and feet, weakness of muscles in the feet and hands, sharp pain and cramps, extreme sensitivity to touch, and specifically insensitivity to temperature changes. So what type of diabetes neuropathy we can see? There are basically categorized into 4. They are peripheral neuropathy, autonomic neuropathy, proximal neuropathy, that is diabetic polyradiculopathy, it is also said to be, and mononeuropathy, that is focal neuropathy. In peripheral neuropathy, we can see many nerves may be involved, but in mononeuropathy, that is the single nerve is involved. In the peripheral neuropathy, we can see in each neuropathy, there are certain different symptoms are seen, though certain symptoms are common like tingling, numbness, pricking, insensitivity. These are very common. But in every neuropathy, different symptoms are explained. Like in peripheral, for example, in peripheral neuropathy, numbness and reduced ability to feel pain or temperature changes, tingling or burning feeling, sharp pains or cramps, muscle weakness is one of the most important, extreme sensitivity to touch. For some people, even a bedsheet's weight can be painful. And serious foot problems such as ulcer, infections, and bone and joint damages. In the autonomic neuropathy, what you can see is a lack of awareness that blood sugar level are low, hypoglycemia unawareness, drop in blood pressure when rising from sitting or lying down that may cause dizziness or fainting, which is called as orthostatic hypotension, bladder or bowel problems, slow stomach emptying, gastroparesis, causing nausea, vomiting, sensation of fullness, and loss of appetite, difficulty in swallowing, changes in the way the eyes adjust from light to dark or far to near, increased or decreased sweating, problems with sexual response such as vaginal dryness in women and erectile dysfunction in men. In proximal neuropathy, that is diabetic polyradiculopathy, the symptoms we can see severe pain in buttocks, hip or thigh, weak and shrinking thigh muscle, difficulty rising from a sitting position, chest or abdominal wall pain. Mononeuropathy is difficulty focusing or double vision, paralysis on one side of the face, numbness or tingling in the hands and fingers, weakness in the hands that may result in dropping things, pain in the shin or foot, weakness causing difficulty lifting the front part of the foot, and pain in the front of the thigh. So these are various symptoms explained in various neuropathies. So this diabetic neuropathy, it's a damage to autonomic, motor or sensory nerves that results from metabolic or vascular derangements in patients with long-standing diabetes mellitus. Symptoms of this disease like pain, that is ruja, tingling sensation, numbness, these are due to, according to our science, visheshan of vata dosha, burning may be due to pitta dosha, and so on. So when we say the sensory, motor, or autonomic nerves are involved, body-wide processes that damage the nerve cells, nerve fibers, and nerve coverings, that is myelin sheath, is mostly damaged. And that's why we have these symptoms like pain, disability, burning sensation, loss of sensation common in neuropathy. As we all know, the nervous system comprises, that is, of CNS and peripheral nervous system. So neuropathy impacts mostly on peripheral nervous system. So in accordance with the three affected nerves mainly, that are of sensory, motor, and autonomic. Sensory, which is responsible for receiving sensation to brain, as we all know. Motor, responsible for movements of the muscles. And autonomic, mainly related with the systems or the organs, that is how the heart rate functions or blood pressure fluctuates, that is BP goes up and down. When we see neuropathy, exactly what happens to the neuron, that is axon and dendrites. You can see the interrupted structure in the diabetic neuropathy. When we see a structure of the neuron, as we know, that comprises of axon and dendrites. Axon, which is a thin long fiber, carries nerve impulse away from neuron cells body, while dendrites are shorts and which are highly branched, which receive nerve impulse from other neurons. So it is basically the communication. There in the neuropathy, you see the interruption in the axon or the axon part specifically. Next. Presenting symptoms in the sensory, they are hypersensitivity to touch, pain in affected nerve part of sharp intensity burning, numbness of hands and increase in time, numbness may be pricking or tingling. In the motor, it is weakness in affected areas, lack of coordination in walking, complete paralysis of affected muscles. And in autonomic, as we see, it is mainly hard to beat heart, hard to bear heat, change in the blood pressure, dizziness, sweating, bowel, bladder, and digestive problems. Type of neuropathy. What type of neuropathy as we usually see? There are neuropathy, as we have seen, polyneuropathy and mononeuropathy. Involving damage to only one nerve is mononeuropathy, and affecting two or more nerves are polyneuropathy. Classification based on the anatomy: small fiber neuropathy, mononeuropathy, proximal motor neuropathy, and large fiber neuropathy. As we can see how it is categorized here in a nice picture, how you can see the ulcer or the slow healing wound. There is sensitivity to touch, lack of sensation, then difficulty in walking, numb feet. This is typical symptom shown of peripheral neuropathy. In the clinical classification next, it is again classified into three: bilaterally symmetrical peripheral polyneuropathy, that is sensory neuropathy, you can see, mixed sensory motor polyneuropathy, and motor polyneuropathy. In clinic secondary, you can see in the symmetrical or asymmetrical proximal motor neuropathy, mononeuropathy, that is involved are cranial nerves, peripheral nerves, abdominal polyradiculopathy, and autonomic neuropathy. Differentiating features between neuropathy and vascular pain. We can see in the neuropathy, if the site of the pain, feet more than cows are involved, whereas in vascular, cows, thighs, and buttocks rather than feet. In quality of pain, if you see, it is superficial, sharp, burning, and tingling, whereas in the vascular pain, it is deep pain. Present at rest, which is very common in neuropathical pain and vascular pain, it is very rarely. Effect of walking is pain improves in walking. In neuropathical pain, in vascular, it is made more worse. So pain worse in bed, as in neuropathy, it does, whereas in vascular, it doesn't. Effect due to glycemic changes, sometimes they are observed in the diabetic neuropathy, in neuropathical pain, whereas in vascular, it is not. So does neuropathy affect blood vessels? It can affect blood pressure, temperature control, digestion, bladder functions. The nerve damage affects the messages sent between the brain and the other sense organs and areas of autonomic nervous system. These areas include heart, blood vessels, and sweat glands. So in peripheral vascular disease, next. Here you can see in peripheral vascular disease, poor blood circulation to the extremities due to blocked artery, which can have dangerous consequences, including gangrene also, and limb amputation finally in extreme cases. Now, who is at risk maximum? It is the diabetics patients, people beyond the age of 55 to 60, males are more prone, hypertensive patients, smokers, people with high cholesterol, and obese individuals which have family history of this. What are the symptoms again? The same as we have said earlier, pain in legs, difficulty in walking, resting pain in the foot at night, and non-healing sores or infections. Next. So now this diabetic neuropathy, when we see from an Ayurvedic perspective, as we know, can be the upadrava of prameha, though it is never been mentioned like clearly diabetic neuropathy. But you know, every disease is not certainly given particular name as our text says, but looking at the dosha, dusha, samurshana, samprapti, purva rupa, rupa, we have to diagnose exactly and give the treatment. And accordingly, if you try to diagnose and treat the patient, definitely the cure is 100%. So for the clinician, it is essential to relate the symptoms, understand the samprapti, and want to treat the root cause of the disease. So here it are the etiological factors explained in our text. As we all know, that sedentary lifestyle, that asya sukham, swapna sukham dadini, sedentary lifestyle, excessive sleep, curd, meat, soup of domestic, aquatic, marshy animals, milk products, freshly harvested food articles, all this jaggery preparation and all other kapha-promoting substances, laziness, intake of food which are cold, anakta, sweet, fatty, and liquid. You know Asya Sukham, as we say, in today's world, though a patient may not be following all this because of the changes in the lifestyle, increase in the stress level, these symptoms are exhibited. You know the jobs are sedentary within the comfortable environment of air conditionings. Person even doesn't get time for continuously sitting. They do not even sometimes get up from the chair. So such patients are more prone to, and having diabetes, these are more prone towards this diabetic neuropathy. When we see Samprapti Ghatak, we know three doshas involved are Kapha, Kledaka, and Shleshaka, Pitta, Pachak, and Brajaka, Vyan, and Apan, Vayu. Dushas, dhatus, Rasa, Rakta, Mausa, Meda are most prone involved. Ambu, Vasa, Lasika, and Oja. Next. When we look towards the Samprapti, we know from the main hetu what is caused is Tridosha Dushti, wherein Kapha, Kleda Kapha, Shlesha Kapha, Dushti, Pitta Dushti, Pitta Dushti and Vata Dushti, which leads to Agni Mandya. Here it is Bahudrava Shleshma Dosha Vishesha, as it is said in our text. Bahudrava Shleshma Dosha Visheshaha Bahudrava Gunayukta Kapha, that is Kledak Kapha Vikruti, is mainly seen. And there is finally Dhatvagni Mandya, which leads to Kledotpatti. Here in after Dhatvagni Mandya, that is Dhatu Vruddhi. Dhatu Vruddhi is of Apachita Dhatu. They are not Upachita Dhatu. This is most important to be noted. That is Dhatu Vruddhi is Apachita, not Apachita. Not Apachita, sorry, not Upachita, and which leads to whatever Kapha Bhuishta, Bahudrava Shleshma, as I earlier said, Kapha Bhuishta Bhava Padarthas are there. For example, as said, Medo Astra Shukrambu, Vasa Lasika Majja, Rasauja Pishita Chadusha. So all these, like this is not here. Next slide you can show. Medo, Astra, Shukra, Ambu, Lasika, Vasa, Majja, Rasa, Mausa, Rasa, Rakta, Mausa, all these are involved in Dushya. And whenever after Apachi Dhatus are formed, there is Shtilata, and when Mausa Dhatu gets Dushta, again there is Srotorod, which can lead to Vata Dushti, so we can either consider as Mausagata Vata, or the Srotorod may cause Rasarakta Dushti, and it can be lead to Vata Rakta. So Vata Rakta or Mausagata Vata. Srotasas involved Udakvaha, Rasavaha, Raktavaha, Mausavaha, Medovah, Majjavaha, Shukra and Mutravaha. Sthan, Vyaktastan is Tvacha, Adhishtan is Rasa Rakta, Swabhavi Chirakari, Roga Marga is Madhyam Marga and Bahya Roga Marga. Due to increase in Kledak Kapha and Dushti of Saman Vayu and Pachak Pitta, Dhatvagni Mande is caused, as I said earlier, and this Apachita Dhatu Vruddhi leads to this disease. Next. Symptoms, we can see, as we, one more thing to be said, as we all know, it is said, Tesham Sadati Daptibdam Dhatu Vruddhi Kshayod Bhavaha. With this, we can know that how Dhatu Vruddhi, Apachita Dhatu Vruddhi takes place, and there is, there is Dhatu Shaitilya. Symptoms again we can see are loss of feeling, numbness, tingling, burning sensation. Next. Chikitsa is Nidana Parivarjan, main chikitsa for every disease we know. Sanshodhan and Shaman Upakramas be given. Snehan with Vishagarbha Tela. General chikitsa Bala Pinda Sveda with Ashwagandha and Bala being anti-inflammatory, strength promoter and Rasayana. Niroha Basti, Dashamulak Vata, Tila oil Sandava. In Shaman Chikitsa, Ampachak Vati, Dashmula Rishta, Trifala Gugul, Chandra Prabha, or Vasantak. There are many things can be given depending upon the severity of the disease and involvement of the Prakruti. Like we can say Vasanta Kusumakar can be given also. Even Yashad Basma also can be given. Trivanga Basma can be given. Next. It's one case study. A patient, there many patients come to Kamakshi Arogya Dham with diabetes, diabetic neuropathy, and they are treated in our hospital. Only 2 cases I'll quote here. One, first is a patient with age 68 on insulin 10 units for 1 year, diagnosed for diabetes mellitus in 2013. He had pain on extension and flexion of the knee joint along with on and off numbness of the feet, burning sensation of the feet, reduced sensation in both the upper and lower limbs, in glow, as it is said, in a glow and stalking pattern was found. Unsteadiness of the gait, reduced pinprick sensation and weakness. Hematological investigation done in 21 when he came to the hospital also. HbA1c 8.9, 13 HB, TLC 5700, neutrophils 56, lymphocytes and eosinophils. Ayurvedic parameters patients was Vruddha, Prakruti Vata Kapha, Sarata Asthi Meda and Samvahana Madhyama. Treatment given was Abhyantara and Bahya, Shirabala 101 tablet, Chandraprabha Vati, Vasanta Kusumakar, Eranda Tail and Guduchi Churna. And Bahya Chikitsa was Udvartan, Abhyanga, Basti and Pada Dhara. Internal medication was given, Shirabala given thrice at T1 TDS with hot water for 2 months. Chandraprabha 250 mg twice a day before meals. As we know, kalas are given very much importance according to our Science. With hot water for 2 months, eranda tel 10 ml with milk for 2 months at bedtime. And Guduchi Churna was given 500 mg morning evening with hot water for 2 months. Udvartan, Abhyanga, Udvartan with Trifala Churna, Abhyanga with Balatail Pindatail, Matra Basti, Sahachar and Tilatail. Nirhoa Basti was also given with Dashmul Nirgundi, Vetyasat Karma. And Padadhara important, given Sahachar Tail and Mahamashatail. Symptom score we have calculated 3, severe 3, moderate 2, mild 1 and absent 0. Next. So when we see before treatment and after treatment, unsteadiness in walking was improved, numbness, burning sensation and aching pain was also improved. Pricking sensation, which was 2, became 0, and difficulty in extension and flexion of the knee was also from 3 reduced to 0. Investigation in July 21, HbA1c was 6.2, HB was 13 increased, TLC 5800, neutrophils 50, lymphocyte 33, eosinophil 10. Five minutes I'll take. She said it's time up, so I'll take just 5 minutes. Mode of action of procedure. As Udvartan, you know, it brings sthirata to the muscles, which is lost due to loss of Baudrava Shleshma. Udvartan is given. It improves sensory perception of the skin as Vayu dominates. Abhyanga, before previous slide, just previous to this. Abhyanga is Vatahara, Bhasti is which does Vatashaman, all we know. Padadhara to improve the circulation. Guduchi, as all we know, Tikta Rasatmak decreases glycemic level, Katu Paushtik and Rasayana. Sneha Virechan was given as patient was old and he was suffering from constipation. Next. Next. Vasanta Kusumakar also was given, which has shown very good results in the patients of diabetic mellitus. In the next case study also, there was male patient 48 years, pricking pain in the right foot, burning sensation, itching at medial aspect of the right foot and altered sensation. Next. He was given, he had family history of diabetes. His work was lack of physical activity. As I said in the Hetus also, Asya Sukham, continuously sitting posture. And he had diabetes for 3-4 years. Next. Prakruti was Vata Kapha, Mala Baddha. On examination, varicose pain, right foot, was also seen on posteromedial aspect of both the legs below the knee, with blackish discoloration in medial and lateral aspect of the right foot. Next. Next. The treatment was given Keshwar Guggul, Panchatikta Kruta Guggula, Trivanga Bhasma here, and Sariva, Patola, Nimba were given to him, Gokshura Guduchi and Gokshuradi Guggul. So with this treatment also, next, Jalauka Charan was done 3 times per week. Virechan was given with Snehapan of Mahatikta Gruta and Padadhara was given. Next. So we have wonderful results. I have just presented 2 cases here and we have seen wonderful results in the diabetic neuropathy patients, giving Shamana Chikitsa also and by admitting the patient, giving him Shamana Chikitsa also and Shodhan Chikitsa. So definitely we cannot say that we cannot treat the diabetic neuropathy. We can definitely treat neuropathy provided diagnosis is done according to our science, not considering diabetes and diabetic neuropathy from the modern and treatment from Ayurveda. First of all, you try to see the patient, examine the patient according to our whatever pariksha given, Ashtavida pariksha, Dashavida pariksha, and accordingly you treat the patient, definitely we get good results. Thank you. Thank the organizers for giving me the opportunity for presenting the case on diabetic neuropathy. Thank you very much.